Clinical placement for nursing students in Australia. What are nursing clinical placement really like? I remember that when I was first time going to the clinical placement in the hospital, I was so exciting. I don't know if other people feel. I think that we feel nearly the same. This is some example of the courage that the student have to go for the clinical placement or the nursing have to be challenged. This is some of the this courage just give an example of the student how it's important for the student on the clinical placement, which I just show you that what they expect and what do they check and what is nursing program gonna be. And then come to the question, where are the clinical placement gonna be? This college just have some sample for the student that they have to do 580 clinical placement hour. This is a lot. Let's back to when I was a student first year. On the second semester, I have to do 2 weeks clinical placement, and then every semester we have to do the clinical placement in different hospital, nursing home, and the community nurse. So if you ask us where is a clinical placement gonna be, it depends on your university. They will find the placement for the student. Let me share my experience of my clinical placement. One of the challenge that I have learned in the community, I was placed in the nursing home for 4 weeks in the second year before I finish. This nursing home is quite not really big, but there are a lot of dementia patient or residency who live there. It's quite challenging. So the placement there, they quite different from the hospital. We always have to do things under the supervision of registered nurse. So in the nursing home, we have learned a lot about how they do all the medication, how they interact with the patient who got the memory loss and the behavior issue. So this is an example that I have learned in the nursing home on those years. Later on, in our university, we have to do 4 week mental health. So they place us in 4 week in afternoon shift, which one of the largest mental health in Sydney. I remember that I was too scared because of there are a lot of patients very aggressive there. So we have to comply with a lot of protocol and policy of nursing in the mental health unit. So you have to be safe when you work there as the nursing student because we don't know a lot of things. I remember that one night one of the patients become quite aggressive. So we have to observe how do they manage with the patient who have behavior issue like this. So a lot of things that we think that we able to do, but actually we cannot. We have to observe how do they deal with, and in the daytime they have a family meeting, they have a psychologist there, they have a lot of problem that is not the same as the ward in the hospital, like medical ward or surgical ward. They manage the patient on their behalf. So this is quite interesting. One of other my clinical placement, I was placed in aged care for how many weeks? I think is 2 weeks. So I have learned according to my RN who supervise me, there are a lot of medication for elderly, and to manage with the elderly problem, daily living. So a lot of things is totally different again. So we have learned something from the university. However, this is the real challenge. This is the real right that you have to work, you have to get ready to get into the real life that you will become a registered nurse soon. So how you gonna manage your time, how you gonna deal with all the different situation when it happen in the nursing. And aged care quite different again because of there are a lot of elderly in the aged care, and there are a lot of elderly problem because they got a memory loss. They may have a short-term memory loss or long-term memory loss. So nursing students have been challenged by RN to be able to observation, to be able to manage. When you come to the real time, it totally different from the university that we have learned. What is my impression? I love in the recovering. I was placed up in the recovering for how many weeks before I finished my uni. I love it there, but a lot of nurses they don't quit the job there. The job there is don't need to do the night shift. So I got a very good experience of the recovery nursing. They are observe the patient post operation. It's totally different again from the medical ward and from community nurse from the nursing home. So what is a clinical placement? So they want the nursing student to have a challenge to come into the real life, how you gonna work as a nurse with the patient and interact with other team. For example, deal with a doctor, communicate with other healthcare team, and how to do practice all the medication, other procedure. This is the real life of nursing that we're gonna do in the clinical placement. Are we allowed to do on our own? No, you have to do according what the policy and university. So when it comes of the clinical placement, hope all nursing students will be enjoy and improve their skill and have their perspective of nursing job in real life. Good luck everyone. Don't forget to subscribe Nurse Jong In Australia or have all the video once a week. Hope it will be useful for you to listen and become a nurse in Australia. See you again.